Hello and welcome to our special broadcast. We call it Health with Sneha, in which we discuss all things health. Now, this week we saw the unfortunate demise of well-known singer, extremely popular and talented. And right in the very beginning, there was a lot of speculation that this is because of a heart attack, some sort of an heart ailment. Now, the post-mortem report has clearly said that KK died of myocardial infarction, and this was the cause of KK's death, is what we are learning, is what the hospital authorities who carried out the postmortem on him said. Now, what is this disease essentially is what we want to know from our expert on the panel. Today we are being joined by Dr. Rajneesh Kapoor, Vice Chairman, Interventional Cardiology, Heart Institute, Medanta Hospital, here in the National Capital Region in Gurugram. Dr. Kapoor, thank you for your time here. From the very beginning, there was a lot of speculation that KK has passed away because of a heart attack. What really has happened, if you could explain to us, what could have been done better to salvage the situation the minute he felt uneasy as well?
Yeah, so first of all, thank you for having me here. This is quite an awareness enhancing situation which we should discuss all about. So what I am also gathering and seeing the videos that singer KK had some chest discomfort while doing that concert and some shoulder discomfort, but somehow it got ignored and situation really got into a complex zone, which nobody wanted, but somehow ironically we lost him. So now this is a scenario which is quite common. This is not an uncommon situation that any person can have these discomforts, some chest heaviness, some tightness in the neck, some shoulder discomfort, or simply they don't feel comfortable, that they feel like they are having some acidity. So these all symptoms actually can be symptoms related to heart disease, or it can be symptoms of evolving heart attack. And if missed or if ignored, this can be life-threatening, as we have seen. So the best way is, if first of all, the person who's feeling these symptoms, who's feeling this discomfort, they should not underplay it. They should categorically come out that I am not feeling comfortable and I am having these symptoms. And if you watch the videos, singer KK was actually sweating throughout. And if somebody is having these symptoms with sweating, all the more reason to suspect that it could be a heart attack. So the person should be very clear in telling the vicinity, in telling the people nearby that I am having this discomfort. And then it's a role of persons who are actually there in that situation. So now if they suspect that this could be heart attack, the first thing which should be done is make the patient comfortable, make him lie down comfortably so that he's in a totally resting situation. And then try to get somewhere, if ECG can be done in the nearby situation, any nearby venue, to get an ECG done. But in all this, make sure that we are not rushing. The anxiety levels should be low, and that person, the susceptible person, should be resting, which was not done in this case. Rather, it was...
Dr. Kapoor, I have so many questions to you, because when this happened, we were continuously talking about the fact that, he was taken from the venue to the hotel. Was that precious time lost in between is my specific question to you. Should he be rushed to the hospital instead of going back to the hotel?
Absolutely. Absolutely. This is the real fact which should have been done, that he should have been rushed to the hospital rather than a hotel. And if you know by data, once a heart attack starts, once anybody is evolving through a heart attack, the first 30 minutes or first 40 minutes are really precious. So if we lose that, we are actually getting into a zone where it can be more life-threatening. So obviously that golden period, it's called golden hour, first golden hour. That golden hour was lost in this case. Probably it could have been salvaged if he would have been taken to a hospital directly rather than a hotel, because that is the precious time. And if it would have been diagnosed appropriately at a proper time much earlier, then then comes the actions. What to do then? Obviously, if he's into a hospital, the cardiologist and full team starts operating on him, starts giving him full treatment. There are many methods of treatment. First, the antiplatelet, the blood thinning medicines should be given. And then if the ECG diagnosis is very categorical that it is a acute heart attack, he should be directly taken to a cath lab where angiography should be done. And then if the occluding artery, the culprit artery needs to be opened immediately, we go ahead and open that artery to salvage a patient.
Dr. Kapoor, a lot of Indians, and by lot I mean quite a bit, do not know that they are hypertense. How many of us are actually going in for regular screenings to understand if there is a history of some cardiovascular problem that could eventually lead to a heart ailment or a heart attack, even like in the case of KK? The post-mortem report seems to be suggesting, I'm just going to be just reading out from there, that KK had prolonged cardiac issues. His family, his friends whom we spoke with have said that there was no history of any sort of a medical ailment. We do not know of any. This is just not the case with KK. Many Indians do not know that they have these issues unless the heavens fall, unless things of this nature happen, unless there is a shocker. That's when they realize that the heart health is not okay.
I absolutely concur with you on these points. This is a real unfortunate situation that most of the Indians, they take the health very lightly in a very callous manner. So anybody, if you take any family, they are ready to go to see a movie and spend 4,000-5,000 rupees, but they are not mentally ready to spend the same amount for health investigations even once a year. So this is a real unfortunate situation. So one, these things can be picked up by regular screening methods, by regular checking of blood pressure, by regular checking of your sugar levels, and by a very simple test called stress test. We call it as a stress test. It's a treadmill-based test. That is one test where the disease is picked up earlier, once before it hits. So we can pick up that patient is rather how much vulnerable that person is for a heart ailment or for a future heart attack. If that stress test is really abnormal, then we should go for advanced testing like CT coronary scans or even a conventional angiography to pick up the disease and pick up the real vulnerability of that person, how much bad the situation inside and how much vulnerable that person is for heart attacks.
So who should be doing this? Should everybody be doing it, or for those who are particularly predisposed? I mean, if there is a family history, what should be the criteria, Dr. Kapoor?
Yeah, so I think very clearly, firstly, any person beyond the age of 50 years, we should emphasize they should go for all screening tests.
Okay.
Secondly, if there is a strong risk factor in that family tree, if the person is diabetic, if in that family there is a strong history of heart disease, especially at a younger age, if that person is hypertensive or smoker, and a person is obese and diabetic, so these are some of the strong risk factors for heart disease. If there are these risk factors, even beyond the age of 40 years, these tests should be conducted annually. So we're not asking for anything really great, anything really out of the blue. It's simple, half a day, some screening tests annually, which will give us total clarity how much safe is that patient from heart disease.
Dr. Kapoor, as we wrap this show, I'd like to ask you, what else is the kind of advice that you'd like to give Indians? And also there is this, a lot of conversation about Indians being more vulnerable to heart disease, or particularly actually South Asians being more vulnerable. Is that correct? Can you throw a little more light on that as well?
Yes, absolutely. So we as Southeast Asians, as Indians, are more vulnerable as compared to rest of the world for heart disease, and reasons are pretty common. The genetically we are more predisposed. If you see, there is somebody in the family somewhere who has a heart disease, so it is running in families. Genetically, we are more predisposed. Diet wise, lifestyle wise, we are more predisposed. Our eating habits are totally haywire. Our exercise habits are not there at all. There are 70-80% of the Indians who are really
Inactive.
having their lifestyle as a totally sedentary persons. So all these things actually lead to lot of vulnerability for heart disease.
Okay. Also, your last piece of advice to everybody who's looking at these developments, because I'll tell you very honestly, when we have events of this nature, it does send a, a sense of shock and panic also, given that, somebody like KK, and he was a popular singer, talented, well-to-do, could have used this time, some time and effort and also finances to look at his own health. We often tend to neglect ourselves is the larger message that has come out of this episode, unfortunately. What could have been done better for many people, or what should be done, like you said, to avoid to be in a situation like this?
I think this is $1 million statement which I would like to give here through this forum to create better awareness about heart disease that we keep on doing. But it's a life lost, and it's a life lost of a very popular artist. So similar things are happening in the society which are not even known. So I think the message is very categorical, very emphatic, that our threshold for having the cardiac screening investigation should be very low. So annual cardiac investigation screening test should be done beyond 40 to 45 years of age for everybody. We are not asking much. See, we are trying to salvage more lives. If the disease is picked up earlier, we have lots of answers. But then, if emergencies like this happen, then it's very difficult to salvage a patient. So, message is go for your cardiac screening test at your nearby hospitals. Annually do it, which should include a sugar levels, cholesterol levels, your heart echocardiogram, and a stress test. This is not really asking for much in terms of cost. Also, expenditure is not really great. So this is one. Second, prevention is the best cure. Everybody, every Indian should go for morning walks, daily walks, at least 40 to 50 minutes a day. Take care of your dietary habits. It should be all healthy diet, and leave aside, you restrict all the oily things and deep fried stuff and all the sweet stuff from outside. This one has to do to keep the heart healthy. And third important thing is manage your stress well. Even stress is a very big trigger in these days for heart attacks.
Yes.
So manage your stress well. Do not keep the things to yourself. Discuss with your friends and family so that your stress levels are down. If
Yes,
you are a smoker,
Doctor, in
if
this
you're
case, it may
yeah.
not have been negative stress for KK, because here's a very popular singer who's holding a concert, but the postmortem report did say that there was a great level of excitement during the concert. Doctors have said that if he also, this is an additional point that I'm making, that he would have been saved had CPR been given. I want to talk to you a little about CPR also, but the very fact that they have spoken about this great level of excitement during the concert that could have contributed to this heart attack.
Yeah, absolutely. So I think even the artists, once they are performing, they are going through a lot of anxiety and excitement and stress. So stress of performance is always there with everybody. So one should learn how to manage it. So this is one aspect which is very important to cut down the heart attack risks or vulnerability in the present era. If we take care of these three, four things, you know, uh, we go for a more active lifestyle, daily walks, take care of our diet, manage our stress well, no smoking. If anybody is a smoker, smoking is a very big risk factor. And if anybody is a diabetic or hypertensive, manage your sugars and blood pressure well with all the medication as prescribed to you. Be very meticulous in that. So these four, five things become very, very important to keep your heart healthy and keep your life healthy.
My last question to you, doctor, and we've spoken about this with various other cardiologists in the past as well. The essence of CPR and the importance of it, unfortunately, the lack of awareness around it. I mean, like I keep saying this, that even I'm guilty of not being able to do it. We should, everyone should learn this, and this is a necessity. How to do a CPR is extremely important. Do tell us a little more about why this is not taught as an essential life skill.
Yeah, so this is also very important. We take lots of lessons, lots of classes, we create lots of awareness programs as cardiologists to, make this CPR thing known to public by various forums. We keep on doing that. So CPR is cardiopulmonary resuscitation. This is the full expanded term for this abbreviation. And it is actually reserved or indicated for a person who has collapsed. Person can collapse anywhere in any public area, be it cinema hall or be it hotel or anywhere. So if any person collapses, now if in the vicinity there is some person who knows how to deliver a CPR, can salvage a life. So now what happens once a patient collapses, the heart, there is a cardiac arrest. If that cardiac arrest continues for 2 to 3 minutes and brain is not receiving a blood supply, then we lose a brain, even if the heart comes back. So this time is very, very important, and only CPR can salvage this situation. So CPR is chest compressions. So one should know to do the chest compressions. If somebody has collapsed, make the patient lie down on a hard surface. Note whether any breathing is there or not, any pulse is there or not. Once established there is no pulse, no breathing, start the CPR. CPR is a powerful, forceful chest compressions. Keep on doing that, and side by side somebody should ask for an ambulance or call to a hospital so that patient can be shifted to a hospital, and continue the CPR while the patient is shifted to a hospital. So what we are doing, we are trying to maintain the circulation to the body and the brain. So there are many situations which has happened in front of our eyes, where after 5-10 minutes of collapse or cardiac arrest, the patient's heart can respond by all these measures. Patient heart comes back, but then if adequate CPR was not given, patient becomes brain dead. So all this is very important, but in this forum I can tell you this much only. It is a forceful chest compressions, and one should really know. It's not very, very tough or very difficult. It's very easy, but one should be really knowing the details how to carry it out.
Okay. Dr. Rajneesh Kapoor, thank you so much for your perspective and your views. And I hope the viewers had a lot to take away from this important conversation that we are having about heart ailments and heart diseases that continue to kill in India. And I hope that this case of popular singer KKR continues to be an eye-opener for all of us, really, when it comes to awareness around